Good day, and welcome to Progressive Care Leadership Shareholder Conference Call and Business Update. Today, all participants will be in a listen-only mode. Should you need assistance during today's conference, please signal for a conference specialist by pressing the star key followed by 0. Today, certain statements included in this presentation that are not historical or current facts will include, but are not limited to, those related to our financial and business expectations and outlook, the impact of evolving and uncertain healthcare environment, strategy and growth drivers, utilization and patient volume trends, revenue visibility, anticipated member renewals of GPO participation agreements, cross and upsell opportunities, acquisition activities and pipeline, revenue available under contract, purchases under our share repurchase program and the financial impact of share repurchases, tax reform and cost savings efforts, potential dividend payments, and 2020 financial guidance and related assumptions are forward-looking statements within the meaning of the federal securities laws. Forward-looking statements may involve known and unknown risks, uncertainties, and other factors that may cause the actual results to be materially different from historical results or from any future results or projections expressed or implied by such forward-looking statements. Accordingly, readers should not place undue reliance on any forward-looking statements. Readers are urged to consider statements in the conditional or future tenses, or that include terms such as believes or belief, expects, estimates, intends, anticipates, or plans to be uncertain and forward-looking. Forward-looking statements may include comments regarding the company's beliefs and expectations as to future events and trends affecting its business, and are necessarily subject to uncertainties, many of which are outside the company's control. You should carefully read the company's periodic and current filings with the OTC markets for more information on potential risks and other factors that could affect the company and its financial condition or results of operations. Forward-looking statements speak only as of the date they are made. The company undertakes no obligation to publicly update or revise any forward-looking statements. This presentation includes certain non-GAAP financial measures as defined in Regulation G under the Securities Exchange Act of 1934. Schedules are attached and that reconcile the non-GAAP financial measures to include in this presentation to the most directly compatible financial measures calculated and presented in accordance with generally accepted accounting principles in the United States. You should carefully read Progressive Care's periodic and current filings on the OTC Markets website for definitions and further explanations and disclosure regarding our use of non-GAAP financial measures, and such filings should be read in conjunction with this presentation. At this time, I would like to turn the conference over to Jay Weisberg, Chief Executive Officer. Please go ahead, sir.
Thank you, Chris. Good afternoon, and welcome to the conference call for the quarter ending June 30, 2021. I am Alan Jay Weisberg, Chief Executive Officer and Chairman of the Board of Progressive Care, Inc. Joining me today are our Chief Financial Officer, Cecile Baruta, our Chief Operating Officer, and our Director of Administrative Services, Bob. The second quarter of 2021 was very exciting and at the same time a challenging period for us. I'd like to introduce our COO, Baruta, who will discuss some of the operational challenges the company faced during the last 6 months.
Thank you, Jay. The ongoing COVID-19 pandemic had a disruptive impact on our labor force. Our primary business, pharmacy operations, including COVID testing, is highly labor-intensive. Worsening conditions due to the COVID-19 outbreak in Miami-Dade and Broward County, as well as City of Orlando, led to a large scale employee absences due to employees contracting the virus. Our workforce was also disrupted by employee absences due to care for sick family members or issues with childcare or remote schooling that prevented them from working full-time hours. We also experienced challenges in the labor market as it related to hiring new employees due to fewer workers seeking employment, since unemployment benefits were extended and increased. This led to an overall smaller selection of qualified workers. We were also experiencing fierce competition from our larger competitors, as well as hospitals and government agencies for hiring workers for testing and vaccination, as these companies have offered above-market compensation and sign-on bonuses. We also fought hard through the challenges and difficulties in implementing our new pharmacy software during the 6-month period at our PharmCo 901 and PharmCo 1103 locations. The new pharmacy software system turned out to be impossible to adapt to our fast-paced environment. We gave suppliers management and development teams many chances to deliver on their contracts, but after several months of operating in less than optimal conditions due to software, we have decided to return to our original pharmacy software, RXMD, that we have worked with almost 10 years. Since the last time we worked with RXMD, the software developed had added significant enhancements to the software that will allow us to greatly expand our site. Plus, the development company has made very important concessions as to customizing their software and offered us some significant financial incentives to use their software. We also have a great in-house development team that will work on developing on our own customizable solutions. In summary, the enhancements will allow us to restart our growth in a number of prescriptions filled and begin onboarding of the new clinics. We are confident we will see a turnaround in our script numbers this quarter, and we project significantly higher script count in the fourth quarter of this year. During the third quarter of 2020, the company launched its COVID-19 testing service that produced rapid detection of the COVID-19 virus and antibody testing to detect the presence of antibodies in the blood with market-leading accuracy in 15 to 45 minutes. The systems we use for rapid detection of the COVID-19 virus are molecular tests using a lab technique called PCR, an antigen-based testing system designed to detect proteins from the virus that causes COVID-19, and COVID-19 rapid test cassettes authorized for the detection of antibodies to COVID-19 in human blood. The company provides these testing systems to patients at its North Miami Beach, Hallandale Beach, Palm Springs, and Orlando locations. Our testing sites are equipped with analyzers capable of detecting positive or negative COVID-19 results within minutes. Each site is operated by a clinically trained pharmacy staff and administering tests on and off site. The company has established a reputation of reliable testing partner and currently provides testing services to international travelers and international airlines, chain restaurants, U.S. and international production and entertainment companies, and local healthcare communities. Our testing system allows a patient, employer, or coordinator in charge to schedule the test, pay for a test, and access test results with minimal effort. We are looking forward to further building a stronger market share in Florida as well as in other states. We are extremely proud of what we were able to build in such a short period of time. Back to you, Jake.
Thank you, Baruta. Our 340B business has been going strong as well. We continue to add new contracts for PharmCo RX 340B pharmacy services and third-party administrative services performed for 340B covered entities by our subsidiary ClearMetrics. We have completed development of the ClearMetrix 340B platform, and we are now in the final testing stages where we will be using the platform with some of our 340B covered entities as part of a pilot program. Our goal is to get the production to a full satisfaction point before the end of this year and begin a nationwide rollout in the first quarter of 2022. As you can see, the positive results from COVID-19 testing and increased business volume relating to 340B contracts has validated management's business plan, the objective of which is to complete our evolution into a diversified healthcare service business and to mitigate the risk associated with too much over-reliance on our previously core business pharmacy operations. Later in this call, we will provide an update on our progress towards this diversification. Let's discuss a summary of our quarterly financial report, which provides you with our financial position as of June 30, 2021, our results of operations, and changes in stockholders' equity for the 3 and 6 months ended June 30th, 2021, and our cash flows for the 6 months ended June 30, 2021. The financial statements in this report were reviewed by our independent public accounting firm, Daskell Bolton. Please be sure to review our financial report, which is available on both the OTC Market website as well as our website. Cecile, our CFO, will now walk you through the financial results.
Thank you, Jay. Good afternoon, everyone. As Jay mentioned, it was a challenging quarter for us. Despite the disruptive conditions, we were able to manage our cash position and liquidity through careful planning as well as some support from federal programs such as the PPP loan program. We expect the same for the third quarter of 2021. Also removing significant non-cash items such as gains associated with the fair value adjustments to our derivative instruments, the company still managed positive EBITDA of nearly $78,000 for the second quarter of 2021 and over $219,000 for the 6 months ended June 30th, 2021. This was compared to negative EBITDA of $311,000 and $955,000 respectively for the same periods in 2020. Our cash position was over $2.4 million on June 30th, 2021, which increased over $325,000 over our cash position on December 31st, 2020. We expect our cash position will remain around $2 million throughout the remainder of the year. Our second quarter 2021 revenue, net of PBMCs, was $9.6 million, nearly identical to our first quarter 2021 revenue and increased over $371,000 when compared to the same period in 2020. Much of that increase was attributable to the COVID-19 testing that we performed from our pharmacies during the quarter, which was not present during the second quarter in 2020. For the 6 months ended June 30th, 2021, we recognized overall revenue from operations of approximately $19.2 million, which was a $900,000 year-over-year increase when compared to the same period in 2020. The increase is mainly due to an increase in 340B fees earned of approximately $800,000, COVID-19 testing revenue of approximately $1.6 million, and a decrease in DIR and other PBMCs of approximately $500,000. This was offset by a decrease in pharmacy and other revenues of $2 million. Jay mentioned that we have been trying to diversify our business lines and our efforts to mitigate the risk associated with overall reliance on our primary business line, pharmacy operations. We believe our efforts to execute on business plan are beginning to bear fruit. Our pharmacy services revenue was less than 90% of our total revenues during the 6 months ended June 30th, 2021. This is attributable to the increase in 340B contract revenue and COVID-19 testing. During the second quarter of 2021, we have again expanded the number of contracts for our 340B pharmacy dispensing and third-party administration, or TPA services. The TPA services are provided through our ClearMetrics subsidiary. Revenue earned on these contracts increased over 64% for the second quarter of 2021 from approximately $400,000 to $700,000 when compared to the same period in 2020. Total revenue for the first 6 months under the 340B contracts were $1.4 million and $600,000 for 2021 and 2020 respectively. That is a 127% year-over-year increase. Second, we earned over $1 million in revenue from COVID-19 testing for over 6,000 patients at our pharmacies during the second quarter of 2021. Testing was not a component of our revenue in the second quarter of 2020, as we had not yet obtained permission to perform testing at our pharmacies. We project that our testing services will remain at or above our present level as travel restrictions are lifted and many popular travel destinations now require proof of testing or vaccinations from travelers. We continue to build stronger relationships with our current clients and constantly expanding our marketing efforts towards building new relationships. We are regularly having new organizations reaching out to us for our rapid testing solution. Our Orlando location is beginning to bring stronger results in testing as our marketing efforts come to fruition. We project that our 2021 annual revenue will exceed $3 million from this source, assuming there will be no material disruptions in testing supplies. Third, during April 2021, we have received a large inventory of the Moderna vaccine, which represents 2,000 doses, and began distribution to customers. The company is providing vaccinations at the pharmacy locations as well as administering vaccines at locations such as long-term care facilities, clinics, community centers, and vaccination events carried out in partnership with various community organizations. We're also playing an imperative role in helping to educate our patients and the residents of our surrounding communities on the safety, importance, and value of vaccinations that protect against COVID-19. We also recognize non-operating and non-recurring gains on debt extinguishment that resulted from payment forgiveness of one of our PPP loans from the federal government and a debt principal adjustment by our convertible note holder. Finally, I'd like to discuss the status of our registration statement filing with the Securities and Exchange Commission. As we discussed in our first quarter earnings call in May, we have made a confidential filing of Form S-1 with the SEC. The registration statement was reviewed by the SEC staff, and comments were provided to us for our consideration. These comments were addressed and incorporated into the next draft of the Form S-1, which will be filed in the near future. This completes my remarks on the financial results for the second quarter of 2021 and our business outlook. Back to you, Jay.
Thank you, Cecile. We believe our financial results for 2021 thus far are excellent, given the conditions in the past 6 months. But we also believe we can accomplish much more as we continue along our plan to transform into a data-centric healthcare technology platform with market-leading and innovative solutions to deliver personalized, patient-centered care. we continue to receive many questions from our shareholders about the convertible note payable with Chicago Ventures, which we currently service through the conversion of debt principal and interest in the shares of our common stock. The shares received in these conversions are then sold on the open market by the note holder. Those sales have had a dilutive effect on our stock price. Our efforts to modify the note terms to remove the conversion feature and replace with more conventional features have been unsuccessful. Our debt agreement has share volume limitations that were meant to lessen the potential dilutive effects of the sale of converted shares on the market. We have determined that Chicago Ventures sold shares on the market in excess of the volume limitations in our agreement. We have requested and received partial reductions in the debt principal that we owe them. We have also requested that they resist from sales exceeding the volume limitations in the future. Thus far, since our discussions with them, sale of shares from Chicago Ventures have been moderated. In the interim, we continue to seek other forms of capital, either debt or equity in form, which will be used to pay down the remaining principal balance of the notes. During Q3, we are nearing the completion of our IT, HIPAA-compliant software development and virtual healthcare services, and plan to deliver these services directly to consumers and through channel partners. Our independent contractor, MyApp Corp, has completed the software platform for ClearMetrics, and we are in testing phase. We will then concentrate our efforts to develop new sales channels or expand existing ones and move forward with the execution on our plan of offering our TPA services nationwide. We also signed a service agreement with Eagle Force LLC in February 2021 to integrate its telehealth platform called MyVax into our data platform to offer a digital passport for COVID-19 testing and vaccination results. The platform was launched on July 20 and is capable of managing an individual's COVID-19 vaccine and testing records. Once a Pharmaco RX MyVax profile has been created, patients have a secure way to store health records, including testing records, vaccination records, medication, vitals, and vaccine passport data. It is also capable of tracking vital health data from smartwatches and other devices. The MyVax Passport service, the Passport serves as an easy and secure way to store and manage verifiable COVID-19 related records for traveling or work purposes. It is also available to consumers in a mobile application which is available on both iOS and Android devices. Next, I'd like to review for you our strategic goals for 2021, which remain largely unchanged from our first quarter goals that we discussed back in May. Strive to achieve over $45 million in sales in 2021. Expansion of COVID-19 testing and vaccination programs. Completion of telehealth integration with Eagle Force Digital. Nationwide launch of ClearMetrics 340B TPA services. Secure additional 340B contracts with covered entities. Seek and obtain long-term care facility relationships. Achieve full enterprise profitability and earnings growth. Become SEC registered and fully reporting. complete an uplist to a national exchange. We believe that despite the challenges, Q1 and Q2 2021 have been a promising start to accomplishing each of these goals. As we progress throughout the year, it will be important to keep our management team's vision for progressive care in mind. The healthier we make our patients, the more successful our business will be. And we will not lose sight of that vision, with the added goal of enhancing and creating more value for our shareholders. That concludes our remarks for the earnings call. We'd like to turn now to the questions that we received in advance of the earnings call. I'd like to introduce Bob Bidwell, our Director of Administrative Services, to discuss and answer those questions.
Thank you, Jay. We've received a number of questions concerning the status of our Form S-1 registration statement and our plans to uplist to a national stock exchange. Some of those questions included, when are we going to finally make the SEC filing? Why has it been delayed, and when will it be resolved? Are we still in a quiet period, and why? So here's the current state of our business plan as it relates to SEC registration and the uplist. So we've previously provided you, our shareholders, with our business plan, which was to register with the SEC and uplist to a national stock exchange. That plan must be carried out in that order. To initiate that business plan, we first filed our initial draft of the Form S-1 with the SEC. The Form S-1 registration process contemplates that a company is planning to raise capital in the public market. That form includes a prospectus which requires that the company provide certain disclosures about its business operations, its financial condition, as well as information about its management. We elected confidential status for that registration and for that registration process, which means that we have to remain silent about any statements regarding the registration statement or the uplist process. That period of time is known as the quiet period. It extends from the time that a company files a registration statement with the SEC until such time that the SEC staff declares the registration statement effective. During that period, the federal securities laws limit what information a company and related parties can release to the public. The failure to comply with those restrictions generally is referred to as gun jumping, and we can get into some serious trouble if we don't comply with those provisions. So once we filed our Form S-1, it was then reviewed by the SEC staff, who have then rendered SEC comments. We then submit our responses to those comments. Once those comments are cleared, then finally the S-1 is declared effective by the SEC, and the company becomes subject to SEC reporting requirements. This entire process must be completed before we can uplist to a national stock exchange. It can be and has been a difficult and complex process, and you have to be sure that you have the right investment bankers and underwriters on board to carry out the entire process. So here we are with the status of this process. We received and cleared 2 rounds of SEC comments. The second round consisting of merely 1 question. So we've generally taken that to be a pretty good sign. The next step is the initiation of a capital raise. Unfortunately, our plans in this regard have not yet reached fruition. We have hired a new investment banker, which we believe will get the job done for us a lot faster. Since we filed the SEC registration statement on a confidential basis, we are now in a quiet period until such time that the registration is made effective by the SEC. We've also received numerous questions regarding the status of our note with John Fife at Iliad Research. Jay has previously, and Cecile have previously provided some information regarding that. Some of the questions we received in regards to the note: how much do we still owe them? Have we attempted to renegotiate the terms, or possibly to convert the note into more conventional financing? Can we pay down some or all of the note principal in cash? Is much of the dilutive trading attributable to that? What are we doing about that? To answer the first question, how much do we still owe them? The balance on our note today is approximately $2.2 million, which includes accrued but unpaid interest. We have had several discussions with the lender about restructuring or renegotiating the terms of the note, but ultimately the proposed terms from them have not been favorable to us, the company. Please remember that that note is a contract. We have to abide by the terms of that contract, which includes allowing them to redeem portions of their note and then request either payment in cash or in shares of our company's common stock, in accordance with the conversion provisions of that agreement. We currently need our cash balances to manage our working capital and liquidity needs, and therefore we have not explored repayment of the note with our available cash balances. We have also explored several refinancing opportunities with other financing sources, but those alternatives have either been too expensive for us or they have contained very unfavorable terms. It is very difficult to find financing for healthcare companies our size because there's generally insufficient collateral to offer as a security for a loan. So until we find other affordable financing sources that have non-dilutive features, we'll continue to redeem the note in the same manner as we have in the past. As to some of your suspicions regarding the significant trading activity that's transpired in recent months, we have suspected that some of that significant trading activity that had such a negative dilutive effect on our trading price was attributable to Iliad. And as Jay mentioned, they've admitted that as much to us and have provided a significant discount on our note as a result of the excessive trades that they carried out in the last 2 quarters. We've included in our discussions with them a demand to adhere to the volume limitation provisions in our agreement with them, and we've noted that the trading activity has since stabilized. We also received several questions inquiring about whether we have a business plan, a 3-year plan, 5-year plan. What are some of the goals and steps that we plan to take to reach our goals? I'll tell you that one thing that's been consistent with my involvement in this company over 4 years ago is that our business is constantly evolving. We're always looking at what kind of company do we want to be. Quite simply, our 5-year plan is that we'd like to be a $1 billion diversified healthcare company. We recognize that we would have to take care of the diversification goal before we can meet our more challenging revenue goal. We've discussed previously in this call our attempts to diversify our business. We plan to meet our revenue goals through a combination of organic growth and through acquisitions. We prepared 3-year business projections and set ourselves budgets and performance goals to measure our progress towards our business plan. All of these plans and budgets and goals need one thing to be successful: access to capital. We don't want capital from sources that will be negatively non-dilutive. In other words, we accept dilution if the capital source furthers us towards the goals in our business plan. So we ask for your patience as we work through the registration, the uplist process, as that will give us access to the right kind of capital, the kind that will allow us to execute acquisitions, execute on our digital platforms, and finance the marketing plans to bring our digital platforms nationwide. Finally, we received questions in terms of information that's being provided by us to you, our shareholders. Why did we stop providing monthly shareholder updates? Well, we haven't stopped providing information to our shareholders entirely, but we've changed the reporting intervals to quarterly to coincide with our financial reporting intervals. Much of the financial data that we provided in the past is revenue related. Revenue related to prescription claims can sometimes be fluid, and the payment status of claims may sometimes overlap months before resolution. We have found that our public reporting to shareholders is less subject to change if we provide our shareholders updates after our public accounting firm has reviewed our financial records. Back to you, Jay.
Thank you, Bob. That's all the questions we have for today. We believe that we have provided you with important information about our Q2 financial results and our business outlook. We thank you for taking the time to join us on this call and for submitting your questions to us. We hope that you have a great remainder of the summer season, and we look forward to talking with you again in November during our next earnings conference call.
Back to you, Chris.
The conference is now concluded. Thank you for attending today's presentation, and you may now disconnect.